Hi, my name is Stephen, and I'm a West Virginia University graduate student with the Injury Control Research Center. Today I'm going to talk to you about TBIs and Veterans in Honor of Traumatic Brain Injury Awareness Month. First thing you should know is that I'm a veteran myself with 9 years of service in the Army. For this presentation, I want to talk about combat-related traumatic brain injuries. So combat, we're thinking of places like Iraq and Afghanistan, and things that make these traumatic brain injuries a little more unique. First thing you should know is that these injuries are actually relatively common. Studies have found between 15 and 22% of military members deployed to a combat area may end up having a traumatic brain injury. The majority of these are going to be in the mild traumatic brain injury range, so think of levels like a concussion while they're out there. Other things to consider is that they happen during long, continuous missions, so access to care can be difficult. You're also out there, you're going to be sleep deprived and suffering from physical and psychological stress, which sleep deprivation and physical and psychological stress can have impact on the brain as well. And then you're compounding that with having a traumatic brain injury. It can be much more detrimental. And it's important to note that, treatment for TBIs is more effective closer at the time of injury. And a lot of the reporting of combat-related traumatic brain injuries don't happen at the time, mainly due to long continuous missions, or you feel better after, a couple hours or a day or so that you're, not seeking the treatment that you need. So a lot of these reporting of symptoms and everything else happens months to possibly even years down the road. And that creates some, further problems with recovery and traumatic brain injury. I do want to let you know there are health systems for military personnel and veterans that provide extensive rehabilitation services. These include places like the Military Health System, Department of Veteran Affairs, Defense and Veterans Brain Injury Center, just to name a few. There are other government agencies and private and public practices that offer support. So thank you for your time today for learning about military traumatic brain injury. Thank you.